welcome to another episode of the Division 45 Psychological Study of Culture, Ethnicity, and Race Virtual Mentorship Program. Our names are Desa,
Yue,
Tren,
and Crystal. The goal of the mentorship program is connecting students to seasoned professionals.
Our hope is that you will gain knowledge about various mentorship topics and feel encouraged to develop more meaningful relationships.
we're excited to bring you another year of mentorship from our division. Okay, welcome everybody, and today I introduce all of you to Dr. Dr. Richa Khanna on the topic of psychologists from international backgrounds. So my name is Yue. I am a fourth year doctoral student in counseling psychology at Indiana University Bloomington. And I will start by introduce Dr. Khanna a little bit and then hand off the space for her. So Dr. Khanna is an early career professional. She graduated with her Ph.D. in counseling psychology in 2018 from the University of Missouri, Kansas City. Since then, she has been working as a postdoctoral fellow at University of Delaware's Center for Counseling and Student Development, specializing in topics pertaining to social justice. She is originally from India and is especially passionate with addressing issues concerning international students, women of color, and ethnic minority individuals. Her other emerging interests include feminist work, globalizing psychology, and training, supervising, and mentoring psychology trainees. Thank you so much, Dr. Khanna.
Thank you so much for having me.
Yeah, this is actually a very interesting topic to me as well, because I am an international student from China. So I share some of the common interests as you. So I would be really curious about your experience and perspective. Perhaps we can start by having you walking us through a little bit about your background and how you got into psychology and becoming a psychologist.
Sure, yeah. So I, like you said in my introduction, I'm originally from India. I was born and raised in Mumbai, and it's interesting how I kind of chose psychology. I kind of bumped into, in India, just culturally speaking, and it's not surprising in a lot of different cultures that are non-Western or non-US based, is that, psychology is very much something that's upcoming, and people are having to challenge their kind of preconceived notions about the field and what it involves. So I wouldn't be surprised if like myself, I went into the field also having some of those notions of like, well, I don't know what I'm going to do as a counseling psychologist. I don't know what it really involves. But I knew that I wanted to be in some field that involved investigation and working with people. So you'll be surprised, or like some way it's funny, because I was going to get into criminal investigation and, the Indian police and, things like that. So that was my initial.
Wow.
So, I just thought, well, it's going to involve a lot of studying for the Indian civil service exam. That's what it's called. And they're extremely competitive. And so, I thought more about it. I was like, okay, I don't know if this is really a good fit for me. I had some own ideas about, okay, women being in the field of investigation and what that would involve. So anyway, I did a lot of self-reflection. I also got into the management route of almost doing a human resources degree and MBA in that. Because, because there was a concern about, well, how much money am I really going to make as a psychologist, which was it's a pretty critical decision when you're coming from that kind of culture where systems are not set up in the same way that they are in the US, where, you get a degree. It's pretty much a set path here. You get a degree, you do a postdoc, you get licensed, and, then you can really do whatever you want with that and set up even your own practice if you want to. So I did stumble across a lot of different things before I finalized and felt like, okay, deep down, I think I really just want to be in psychology, and we'll think about the specialization later, but this is what I want to do. So I did my bachelor's from Ferguson College. It's a college in Pune, which is around a 3-hour drive from Mumbai. That's where I was raised. But then as a family, we moved a lot. So I got my undergrad degree there, bachelor's in psychology, and then I moved to, again, as a family. I've never been, I will say this too, living in the US was the first time I lived away from my family, because we always
me too.
have lived together and traveled together, yeah. So, and then my master's degree was from SNDT University. It's a women's university in Mumbai. So that's when actually I chose my specialization as industrial psychology. So I actually, counseling was not my first choice, also because, well, one, I didn't know how much, like where it would lead me. And secondly, there was not enough faculty to teach that course in the university that I was. So I said, well, that's a clear, this is, a no-brainer. Like, I don't think I should be doing counseling. And I also knew I didn't want to do clinical psychology because I didn't want to work in a hospital. And again, this is just from my limited understanding of what that work would involve. I said, well, it feels too severe, too intense, and I don't want to do that. So I ended up doing the master's in industrial psychology. And then when it came to the job search, I was able to find a kind of, not exactly a startup, but a firm that had just kind of come out of the startup phase. So it was an organization that was working in several different areas in India in the field of mental health, including career counseling for school and college students, as well as training for corporate employees. So they were doing a huge range of work and different tasks. Right. So I joined them and I worked there for around 2.5 years. And with time, it just felt like the industrial psych part of it was just not a good fit for me. I wasn't quite liking the work because I was doing behavioral training for employees of corporates, but it was almost like a mandated training. So imagine putting involuntary members into a group and trying to run the group. Right. Very little motivation from there, and I will say I also had to face some kind of like biases against, okay, you're a woman, you're coming and trying to teach us how to be, and and it was mainly like male dominated, at least the employees were, and it was an engineering firm. So that just felt like there were several factors where I felt like, oh, I don't really know if I can keep doing this. I feel like I'm just going to get burnt out, and I myself, I'm not going to have a lot of motivation if I continue to do this work. So I know that was a snapshot of the work, but just from the get-go, I knew this was not for me. So the good thing that happened though out of that is I was also doing, because again, it was a small firm, so all of us were doing a lot of different things. And part of that work, I think, was in some way, I got lucky, is I was also doing the career counseling bit for young students. So starting from like 9th, 10th grade, where in India you have to choose a specialization, or rather a special, kind of core subject starting your 11th standard. You can choose either science or arts or humanities or commerce. And so to make that decision, we administered, aptitude and interest tests and personality tests and inventories. And we did group testing in schools. But then I would also do 45-minute sessions with the student and a parent, or both parents involved in the session. And that's where I felt like, okay, this feels like something I have more energy towards, and felt so much more meaningful. Right. And then a part of me was like, okay, if I want to do counseling, I want to do it, in my mind, the US was the right way of doing counseling, because a lot of the authors, the books of the authors, the authors of the books that we were using were all from the US, predominantly from the US. And so I thought, okay, if I want to go, I want to go all the way, and I want to, get a doctor and a PhD in this. And so I ended up applying for various schools. My initial interest before coming in was in positive psychology and spirituality. So with that in mind, I started searching for advisors and different, APA accredited programs that would, where advisors do that kind of research. And that's where I found University of Missouri, Kansas City. And my advisor, who I ended up working with, was kind of the master of flow. If I don't know if you've heard of it, it's a concept in positive psychology, and happiness and just generally
Right.
making and things like that.
Right.
So, that's where I found my fit. And I applied, I think, to around 4 or 5 different schools, and I ended up getting into UMKC. Again, I think the 6 years that I spent there, including my internship, has really been a very, very interesting journey. I think, like I came in with the interest in flow and spirituality, but just with the focus of the program being so much towards social change and social justice and advocacy, I think the feminist core of me kind of got pulled in that and kind of got tapped in.
Right.
And so, things started shifting for me a little bit. I started reflecting a little more on, through classes and the million reflection papers that you have to write, right?
Yes.
In these courses, like I was like, there's something that is not, that's kind of like waiting to be developed or waiting to come out. And so it's interesting. At UMKC they had us do a pre-dissertation and a dissertation. I don't know. Each university differs and your programs differ, but my pre-dissertation was so different from my dissertation. Had nothing to do with it. So
Wow.
my pre-dissertation was in dispositional flow and spiritual intelligence, and the relationship between that and life satisfaction. And my dissertation was in a feminist identity model in women of color. So
wow.
that itself, those two research topics kind of is symbolic of how things shifted for me over the course of 3 or 4 years.
Right.
And so I kind of became more it's almost like my mind got very kind of diversified. There were just so many different things that I was exposed to, and I'm so grateful for that, because I recognized, I was like, okay, this is my, like what you kind of read through my my bio is that is my core interest, is this work in helping people who are don't come into the traditional model of either treatment or therapy or way of seeking services or help, including somebody from an international background. It's like, yes, we have a lot of international students coming here, yet it's not, I mean, just with things that are going on even socio-politically, like it's hard. It's never stable. It's never that things are going to be the same always, or biases are still there, and I've had to face them, and unfortunately it's a reality that we all have to deal with. But it does change you. It changes you as a person. It changes the way that you think.
Right.
And I think that's what happened during my program, is a lot of things shifted, and I am where I am now.
Yeah. Thank you so much for sharing. Yeah, I think that's a good snapshot of kind of how you picked this path and what happened after that. And I was just reflecting on kind of the theme that I was hearing was a lot of exploration and a lot of trying different paths and figuring out what you want. And that was seems like be the case before you decided on counseling psychology. You considered a number of career options and weighed a lot of different factors. And even if after you were committed to counseling psychology, your research interests also shifted a lot. So it seems like a very enriching experience of lots of growth and unexpected growth, possibly. Yeah. And just hearing you saying, I feel like I have a lot of similar experiences in that regard. I also had considered different career paths before coming to the US and decided that this is what I'm going to do. I'm in counseling psychology as well. And my research interests have also been changed. And actually, I'm also very passionate about seeing things from a feminist lens, which is maybe 4 years ago wasn't even on the top of my mind. So I think the program and training really kind of changed my perspective. And it seems like that was your experience as well.
Yes.
Yeah. I was curious about, as an international student, and I know that each international student's experience is different. However, sometimes there might be some similarities. So I was curious about how was it like for you to come into the US and studying counseling psychology as an international student and as an Asian international student?
Mhm. Yeah. So I know when you think of international, and I know when now I'm like thinking about people I've worked with in, as a counselor who I've provided counseling to, and it's like the first thing we think about is acculturation, right? And that the shift in cultural values. And this for me again is was part of my exploration process. I didn't even know the word acculturation until 3 years after I came
Yeah.
program. And even though I'm pretty sure I must have heard the word before, but for me to apply that to my experience was again very much it was I don't know, awakening is not the right word, but just something clicked, all of a sudden, like, okay, now I know what's going on for me in terms of like, why am I so stressed out? And
Right.
why am I so anxious? I just could not figure it out. And I'm
Right.
telling you, this was like, but starting, I think maybe the second or third year of my program, where you start working with clients and you start noticing, reactions that are coming up for you. And so there was certainly that realization of, I almost wanted to put myself in some kind of stage or phase. I was, trying to figure out, okay, where am I at in this process of, racial identity development, acculturation and acculturative stress and things like that. And so I think that, I don't think that would have happened unless I would have, come to the US. And I will say that, when you spoke about similarities and differences, I think the difference for me, I think when I compared to maybe, somebody who's compared to others who are probably coming from a non-English speaking background, I do think I had some kind of advantage in terms of language, because, in India, the education for me was always in English. So I didn't have to, taking the TOEFL and the GRE. The GRE, yes, was challenging, but the TOEFL was, I remember not having slept a lot the night before, just because there was a family, a wedding in a family, but I basically woke up, with like 2 or 3 hours of sleep, and I was able to take it and I was fine. So I don't want to say that's the traditional international student experience. So my guess is that there are some differences there. And also the way that I had been acculturated, in the sense that, in India, we watch a lot of US media. We watch a lot of shows. Sometimes it's funny because my friends sometimes in India know more about US shows than I do. So they check it with me and like, have you seen Game of Thrones? And I'm like, actually, I don't watch it. How can you not watch Game of Thrones? So, so I think you're right. Yeah, there are a lot of individual differences. And so when I came in, and I was just really excited to be outside of India. I was just excited to get out of my home, and not that, I don't love my country. I think it was just such a new experience.
Right.
Also coming after having some work experience, I don't know how much that helped. Maybe it did, but sorry, I lost my train of thought. It's been a long day. I'm sorry. Okay. I was saying that I'm just going to take a minute. Yes, so I think when coming in, even though I felt like, okay, maybe I do have an advantage over people who haven't, don't have work experience and things like that, I was just still very anxious, but I didn't recognize what, like I said, what that anxiety was until several years after. And I still don't know what that was about. Maybe I was just so excited to be here, and I got into the whole, the PhD mindset of like, okay, just get the work done, do the assignments, get good grades, and a different way of learning. The American education system is so different from the Indian system, where in India, it was, I don't remember half the things that I learned because it was mostly through memorization, and rote. And here people are asking you to like critique articles and like self-reflect. And I said, I don't, based on my self-reflection, you're going to give me a grade? Like, that's really cool. I can do that all my life. If I'm going to get grades based on self-reflection, I can do a lot of that.
Right.
So that, and then even like living situation wise, you know, like I'd never lived with roommates. And so after coming here, I got into that, and, you know, the different relationships to kind of navigate through that. But, you know, I felt very different from other Indian international students at UMKC. So there was almost this, I felt like I was in a PhD counseling psychology bubble, because PhDs in other fields are very different, even though we are from the same country. So that I feel was very unique, because I just could not identify with a non-psychology person after a certain point. I was like, I just can't see the same way that you see the world, even though we are from the same country. So there was that distance. And so I think now as I'm talking about it, I think maybe that anxiety was even just about feeling a little isolated, that, okay, even though I'm a part of this PhD counseling community and we're doing the same work, there are a lot of differences between me and my cohort, or between me and domestic students who are in this program. And, you know, we are seeing similar kinds of clients, but I feel very differently from somebody else, in that, you know, I'm constantly internally comparing, okay, how am I doing? And, you know, you probably have heard of this very common thing of like imposter syndrome. So you start wondering, am I supposed to be here? Is this my space? Am I good at this? Oh, something that I was going to say earlier that I missed out on was my very first semester, when they started giving us assignments in the courses, you know, critique this research article. I actually went to my advisor to help him see if my English is okay. I was so worried about, will I pass? You know, we need a B and above to pass. And I just felt like, what if I fail? And, you know, he had minimal feedback. He said, I think you're fine. Like, and no one else did that. No one else had to go into their advisor and say, can you just check if my assignment is okay? And, you know, I did that a couple of times until I was like, okay, I think I got this. I think I'm fine. But that was a process. And those things are not, you don't know that's going on until, you know, later, that, okay, that's what it was. But when you're in it, you just want to keep going on, and you know, move past the anxiety and kind of in survival mode almost.
Definitely. Thank you for sharing. I think it was very helpful to tease out some of the experiences for you that's unique, maybe different from other international students, but there are also some similar experiences in terms of the stress and anxiety that it involves being an international student.
Yes.
And as you were talking about the English, and I come from a country that English is not integrated in our education. So I speak English as a second language, and I still remember the first semester I was in my master's program, and we had 100 pages of reading in a week, and I was just reading through one page, and there are so many words that I don't know, and I was looking through a dictionary and write the translation on my book, and it takes me an hour to read a page. And it was such a slow moving process, but I guess it was under that pressure that I really improved quickly, and now I can read pages after pages. But it seems like it's just a difficult environment, but push us to grow very fast, but it also involves a lot of stress and anxiety.
Yes. And that's not, and again, that's where you feel like you're different from others, because you don't see the same thing going on for them. You know, others, it feels like it's so easy. It's like, okay, you've been born and raised in the US. How can it be hard for you?
Right. So,
I don't know if you experienced that at all, where you started noticing how you're more different than you're similar. even though you're in the same program. But I would notice that frequently.
Right, right. Yeah. I think that reminds me of some experience, and later I realized maybe it's just in my head, but sometimes in class when the professor says something, I would be like, what is it? But I don't understand what's maybe it's maybe it's a show, or maybe it's a word that I don't understand, but I wouldn't ask it because I thought that I was the only person who didn't know what it is. But later, an American student also asked the question. I was like, oh, okay, so nobody knew. I wasn't the only person. So whenever I didn't know anything, I always assume it's just me. But later people told me, actually, that's something that nobody knows. So
yeah, that can, yeah, but in the moment it's just so anxiety provoking, right? Because you're like,
right,
oh, I'm the only one who doesn't know
right,
this. And you know,
right.
honestly, it happens with me even now where people are talking about shows and I was like, I have no idea what you're talking about. Or just shows, or just culturally very specific things that like you know, I don't, you know, for years I don't have a TV. In the US I've not bought a TV. Like my laptop for everything. And I also don't watch the shows that other people watch, and you know,
Right.
they make references of talk show hosts and all that. I mean, I don't know who you're talking about, but you know, it used to be. I don't think it doesn't always have to be a barrier. I think we can kind of move past that if people are able to connect with you, or you're able to connect with people irrespective of that. I think that's positive. But but yeah, though sometimes, especially if you're new to the country, it can be it can feel distancing, you know.
Right. Yeah, absolutely. Yeah.
So
I was also
sorry.
yeah, no, that's okay. I was also curious about your clinical experience, and I think that's a unique space because we are not only people of color, but we're from another country. So I was curious about how it was like for you to see clients as an international scholar or psychologist, and both in the work with your clients and also with your supervisors. What are some of the positive or challenging experiences?
Yeah. So I knew going into the clinical side of it that I wanted diversity of experience. And by diversity, I meant different clinical settings, because my goal coming to the US was that I want to go back home. I want to go back to India. And that's basically what I'm actually going to be doing now pretty much soon. Once I end my postdoc, is trying to go back to India.
Okay.
So keeping that in mind, I chose, the first site that everyone had to kind of go through was our in-house clinic at our School of Education. So it was a community mental health clinic. And so we saw people, it could have really been anyone. We saw people on a sliding scale basis. And then I did UMTC's counseling center. I worked there for 1 year. And I mean, as you know, I think this is pretty consistent. Most programs, you do one site every year, you kind of keep rotating, right? Your different practicum sites.
Right.
And then after the counseling, I did 2 inpatient hospitals. And one was a long-term inpatient. So it was individuals who are suffering from severe and persistent mental illness. And the other was a more short-term kind of brief kind of therapy model of more acute inpatient situations. So I was very happy to get that kind of experience. I think it was very unique, and I think the training really set me up to see a range of kind of mental health issues, but also a range of the individuals who are experiencing those issues, because the person walking into an outpatient clinic is definitely different from somebody who's been inpatient for a minimum of 6 months.
Right.
You know, and their presentations, their experiences, their way of living are so different. So I think, like I mentioned already, initially I was very anxious. And so what happened is, when I was anxious, is I would talk a lot.
I can relate to that.
And by talking, yeah, you know what I mean. By talking, I meant asking a lot of questions, because I had to fill in the space.
Right.
And so I was again very grateful that the supervisors that I've had were kind of spot on, like people I really needed at every point in my development. So, I got this feedback of, you're basically interrogating the client right now. You need to be more present. And I want to say 6 years later to this day, I still find myself asking a lot of questions in my mind, but being a little more present than I was 6 years back. But it's the same struggle. I mean, the core of me is still, like I just want to know more information.
Right.
And I think what was challenging was my first client was a minor and she just wasn't talking. And so that's where the questioning came in. But I think when reflecting on so my supervision, what was positive is that I could kind of continue to self-reflect. And that's what I've really appreciated about this whole program and this whole experience is that the reflection doesn't stop. Right? You have to keep thinking about what are you doing, why are you doing it, what's coming in the way, how is your identity influencing this work. And that's what I found as the most, I think, enjoyable aspect in supervision is when supervisors allowed me or gave me that space to talk about, okay, like what's going on here, and what was this intervention about, something like that. And this is where I want to talk about again the cultural differences. Is in India the supervision was very, very directive and very much constructive feedback based, and so there was no balance of this is what you're doing well. It was more about what you need to do better. And so when I came in and I saw this style of supervision, how they mentioned the sandwich kind of thing, like you give, whatever, supportive and then constructive and then supportive again, kind that style of feedback. It was very new to me. I was like, what is going on here? Like, why are you focusing so much on the positive? Like, that makes me feel like I'm not doing something right. I'm so not used to it. So that I think was an adjustment for me clinically, is maybe not feeling challenged enough sometimes, where I wanted my supervisor to give me more critical feedback, and all they would say is, you're doing great, like developmentally you're fine. And so I said, well, there has to be something, like how can I just be doing everything good? It's not possible. And I think part of me was that anxiety of, okay, I'm just not perfect and I want to be perfect. And so that's something I had to kind of overcome and be like, okay, yeah, they are giving you feedback, because the feedback was there. I just wasn't seeing it as constructive or something that I could use. I think it was always there. It was, I mean, now in reflection, it was developmentally appropriate. And I think some supervisors in their feedback were a little more on the, this is what you should be doing differently, which certainly I appreciated. The other thing, like I said, was a self-reflective piece. Actually, the first couple of sites that I did, or up until the third site, which was the inpatient hospital, I was writing down my reflections of each client as much as possible, because if it's too much of a caseload, I don't think I did that much, but I would type out, okay, this is how the session went, this is how I was feeling, and I would actually, in my first site, I emailed it to my supervisor so that she could read over it before our session, before our supervision. So I really, I mean, like I said, I love journaling. I love what I'm doing, and I think that served me really well going into supervision, and I appreciated that the program really emphasized that. In coming to kind of my own identities, like I mentioned a little bit about the differences in supervision and receiving feedback, I think with clients, it was hard, because then I started noticing differences in how am I with an Indian international client versus Indian American client versus
Right.
white American client,
Right.
I got such, again, diversity of experiences. At the same time, again, I was being supervised by people of different identities. Some of them, for the most part, were, I think, white supervisors. Some of them were people of color. But again, just the way that I experienced them was so different, and I did kind of, again, start noticing that, start recognizing that.
Right.
It wasn't up until, I think, my internship year where I felt a little more challenged to assert what my needs are. And I want to owe it to the program or my development for reaching that point where I can really say, okay, this is what I need in supervision, and I'm not quite getting it.
Right.
So I think that's been a I guess, progression of my identity as a woman of color, an Indian woman, again, interacting with people from different different diverse identities themselves.
Right.
And being able to really ask for what I need and being able to get that.
Right.
In a culture that is, again, set up, or system that's set up in a certain way, catered to certain types of trainees,
Right.
So it did involve me challenging the system in some ways, and not only during internship, but also during my practicum training, and towards the end, again, towards when I was in the hospitals, because that's when I also felt challenged to help clients or patients who were, not quite being treated respectfully at times. And that's where I kind of tried my best to use my voice, barring all this anxiety. That's where I felt like, okay, the anxiety doesn't really have a space right now. I can't be anxious. I really do something. And that's where I started to challenge a little bit of my own, biases, as well as challenging the system that I was in. That I don't have that much power as a trainee. You're really at the bottom of the hierarchy. They don't really even consider you an employee because you're part-time, right? You don't go there, you're not there 40 hours a week.
Right.
But yeah, it was very interesting. It was a very real world kind of experience. You get to know how to interact with people of different even treatment approaches, but also different fields of mental health, like psychiatrists, nurse practitioners, social workers. We're all kind of working as a team. And how do you work as a team when there are power differences, but you still want your voice to be heard? And so that was a process for me, is speaking up a little more and making my voice heard.
Yeah, that makes sense. Yeah, thank you for sharing. And it seems like the cultural differences brings some adjustments and sometimes strength, because it seems like you were able to pick up on some of the nuance differences between, like you said, Indian international students and Indian American students, and really empathize with how their experiences might be similar or different, but in other times it might be challenging, because I think the point that you said about the system is set up to train a certain group of trainees, I think that was an interesting point. I was wondering if you could collaborate on that in terms of how you perceive the system as being perhaps biased or towards in terms of the training style, and how you have tried to advocate for yourself in that way.
Sure. So I'm trying to think about what I think of some examples maybe that I can So I think when like I said, with going back to the hospital experiences, I'm thinking about this one particular. Well, the the system itself, like I said, one is that it's predominantly white. You know? Not only the mental health providers, the professionals, but also part of the a lot of the clients also who are being served, at least in the site that I went, were predominantly white. It's interesting, where I had worked on that specific unit, I think there were only 2 or 3 women.
Wow.
And even the psychiatrists, I think, were predominantly white males. So I think the challenge was to, okay, firstly, knowing that I have a role here.
Right.
And I was actually assigned to, certain number of patients as an individual therapist. But I wasn't getting that, getting information that should have been received by me wasn't really coming to me, even though I was their provider. So, things like that. And these are systemic issues. It can also be a power issue. So I don't want to say that's how the entire system is, but I'm talking in terms of my own experience and what that would take. It can be different for people. And yeah, it just also felt like the way that patients were being offered treatment was there was a bias in that, there wasn't always complete. I know objectivity is, I don't know if objectivity is the right word, but there was not all. Let me use the word empathy. There was not a lot of empathy on the part of people working with them, at least from my perspective, as people who maybe they were trying to help, but it felt almost like a power struggle.
Right.
And so for me, it was disturbing sometimes to notice that, because you're working with humans, you're working with people who are in distress, and who are also distressed partly because of the system itself.
Right.
So they're kind of being further disadvantaged and further marginalized. And in some way, if I shared an identity with a patient who was also a person of color, I had more empathy for them.
Right.
And that's where I would feel like, okay, I'm going to go out of the way to help you, because I'm, and I hope this does. I mean, I didn't mean to sound, biased in any way, but it just felt like, because they were being kind of on the sidelines almost at times, or not being heard.
Right.
Because what happens in an inpatient is that if the minimum stay is 6 months, you're practically living there. That's your life. And so everyone who's around you has almost become like a family. So it becomes like a family dynamic with the providers, with the professionals, the patients. Everyone is kind of entangled in this this way of life that they get stuck in that pattern. Professionals respond the same way, patients respond the same way. If a patient gets activated, the professional gets kind of drained, and they just do whatever they can. They just give them a shot of medication, and that's all they do. And so, like I said, that was kind of distressing to see. So for me to figure out, okay, what's my role here, and how can I help with support and just being there or hearing someone out. Sometimes it could be as minimal as somebody just needs to get out of bed. That was the therapy I was giving them. I was like, can you come out of the room? Just come out of the room and we'll go like watch something on the computer. It was as simple as that. It sounds very simple, but that's like that's therapy for that person. That's an intervention. So I think, I don't think I'd ever be satisfied with what can be offered in an inpatient setting. The other thing I thought about was, there was this person who was also inpatient, was supposed to be in the short term, in the acute inpatient unit, but he ended up being there again for several months because, some of the issues that happen are because of housing, or somebody's, they're finding housing for the person outside of the unit and for them to kind of, start their life again and be independent in, say, a group home or something like that. But this person was it was a non-native speaker, and nobody knew his language on the unit. And so they said, okay, well, you can use this phone that can help translate what he's saying. But I didn't see anybody really do that. And so I don't know, and then it felt like they were trying to teach him how to speak English, which, yes, it may have been good for him. I don't want to speak for his experience, but I don't know, just things like that were, it was sometimes just really sad to see that.
Yeah, sounds a little condescending.
Yeah, and kind of almost taken for granted, and again, I felt conflicted because I was like, okay, I have empathy for the patients. I want to have empathy for the providers, but I'm also a provider. Like, I don't know if I can empathize with them because we have more power.
Right.
But again, the question for me is like, okay, but where is my power, and how, where do I stand in being able to challenge the system that's probably been going on for a very long time?
Right. Yeah.
So I don't know if I answered your question. I think what I wanted to say when you asked the question about how the system set up that generally serve those who are local or domestic is that there are very little questions asked about culture.
Right.
There's very little curiosity.
Right.
That's where I feel like people need to be challenged, is like, why are you not even asking these questions, and why are you making assumptions?
Yeah.
Or why are you assuming that it's a one size fits all?
Right. Yeah. Definitely.
I think
thank you for sharing.
Spaces, that's what I was noticing happening.
Right. Yeah, thank you for sharing. And I really appreciate you talking about your different clinical settings and experiences. And I think it's understandable that in some specific agencies or clinics, the culture or the awareness around multicultural counseling is less than some of the others. And where we're still trainees, and especially people of color and international students, it's very hard to speak to power and see clients not being treated in an ineffective way. Yeah. I remember I also during my master's program, I had a supervisor who was telling me that she said that my multicultural competence needs to improve because I was not born in the US. So since I'm an international student, I don't know American culture. So I need to learn more about American culture. And I was like, I'm pretty sure that's not what multicultural competence means. But yeah, so I can definitely relate when we're still, even though we have power as clinicians, as practicum students, but we're still in a less powered position comparing to other more senior psychologists or practitioners, and that's a very difficult situation.
Yes.
Yeah.
Especially when it comes to supervision, and you're being evaluated. So it's about okay, now I'm going to pick my battles, right?
Right. Exactly.
I'm not going to shake a system where I'm going to be there for a couple of months and I just have to pass and leave.
Right.
Those are hard decisions to make.
Yeah, absolutely. Yeah, we have a little bit of time left, but I wanted to kind of switch gears a little bit and hearing about your future work going back to India. And I think I was very curious about kind of how, what aspects of the training that you received do you think is applicable and advantageous when you go back to your home country, and what might be some areas that's not very applicable or you need to grow? I don't know very much about mental health in India, but in China, I feel like the clients are very different. The culture, of course, is very different. And there's also different ways of indigenous practices
Yeah.
in healing or even in counseling therapy. So the scene is very different. So I was curious about how you envision the transition going back home.
Yes. So I'm going to say how I feel about it, that I'm very excited. It's a mix of nervous excitement because, you know, as much as I can try to envision what it's going to be like, I don't know how close it is to the reality. So, you know, I have been doing a lot of trying to network a lot for the last several months, I think, since last fall, trying to broaden my network and try to find like-minded people. And so a lot has changed in India since the last 6 or 7 years that I've been here in the US. And part of that is, I think, definitely increased presence in the media regarding mental health issues. I've been sitting here and noticing that there are more, you know, celebrities who have been open to talking about their, you know, their mental health concerns or kind of what they've done about it. I think how, as far as my training goes and kind of answering that question, I'm really appreciative of the cultural sensitivity and the multicultural aspect of my training, because I think I'll be using a lot of that when I go back home. Is trying to navigate identities. And I know that it's not going to be as much race based, but you know, religious. There could be religiosity, there could be sexual orientation, there could be socioeconomic status. I feel like all these identities are going to come into play in the work. And again, talking about how marginalization is so different in India. What does marginalization mean, and what does social justice mean? There's a caste system, you know, for some people, even like their basic rights or the basic survival is not met even by the government. And so for them, mental health is not about changing, you know, the way that they're thinking. It's about improving their situation, right? Getting them the basics that they need to function as humans. And you know, not that, I mean, that kind of makes intuitive sense. I don't think that, yes, it's funny to say, well, I needed this training to understand that. I think it's more about the lens. I think it's about the lens that I'm bringing in. It's about this knowledge that I didn't have when I was in India, because, you know, I want to say I have my own privileges. I have the privilege of having studied in the US. I have the privilege probably of being a, you know, hetero middle class. Yes, I'm a woman, but then there are other advantages that come with education and belonging to a certain socioeconomic class. So I think being aware, this program has, you know, this training has made me aware of all these things. Again, kind of speaking back to that self-reflection, is I've been able to think about these things now, which I probably would not have considered several years back. In terms of the approach, I think there are certain, like you were talking about, indigenous, you know, healing practices. I think in India, there's a lot of, now I'm seeing this upcoming, or not upcoming, I think it was always there, art therapy and expressive art therapy or movement therapy and things like that I haven't, you know, I don't have knowledge about that. So, or even, I know a lot of people here also practice EMDR, and EMDR is also very much practiced there. There's something called neuro-linguistic programming, NLP, which is also very popular there. So, but, and these are again things that I mean, that's my bias, right? I don't know about these practices and how much they're used. But again, having that flexibility of, okay, I have this knowledge. It's not about, you know, fitting any theory to a person. It's about seeing what can you offer? What is the range of different things that you can offer to a person? And so, another thing that's now coming back to me, when I first came to the US, I was primarily, when my organization that I worked in India used a lot of REBT. So the big insight for me when I sat in the theories class during my PhD was the range of theories that we could use. And I was really mocking other theories that, how can there be any other theory besides REBT?
Right.
How do they work? Like saying, as a humanistic, what are you going to do? Like, what are you really doing in session? Like, what's the work? What's the intervention? So that was a bias that I was coming in with when I came to the US. But how I'm leaving is now saying, no, REBT is one way of looking at it. CBT is one way of looking at it. ACT is one way of looking at it. You really have to see what is going to be the best or the most suitable for the client you're sitting with. And I think that has been a major learning for me, is what I'm taking back, is there are so many different ways that you can achieve or help somebody achieve change.
Right.
That it's almost a little liberating, right? Because then you don't have to stick to one thing. You don't have, there's no clear formula. Right. Besides building the relationship, which again was very much eye-opening for me, is this contextual model. The common factors.
Right.
The things that are the build the foundation for the work. And without that you can't do the work. And I did not have that knowledge. So I feel like I'm taking all these pretty major significant points in, because now I'm not going to question somebody who's doing work in India, and if it's working for them, great. It probably follows some theory, but I'm not there to challenge that theory or to say that because I've been trained in the US this is better or worse. And I think I'm having to kind of keep that in check, because it's I'm again, I want to be aware of my biases, because I haven't trained in India. I haven't worked with Indians in India. So that in that sense, I'm at a disadvantage to people who are probably maybe just have a master's degree and are working there for several years. They have much more experience than me in that way. So again, those are kind of the minor, the nuances of this work is. I think it's very important for me to be open to differences and flexible and adaptable like that.
Yeah, thank you for sharing. Yeah, and it sounds like the training really provided you with a really comprehensive background in terms of different theories and different ways of approaching therapy. And when you go back to India, there's probably more to learn about the population and how things are there. And it's going to be a continuing growing and learning process.
Yes. It's a journey, and I'm looking forward to it.
Yeah, thank you for sharing. And just, I know we're a little out of time. Do you have some quick suggestions for international students who are in our profession? Any suggestions for them in terms of becoming clinicians or becoming academics in this environment? And do you have any thoughts for faculty or supervisors in terms of supporting international students?
Sure. If I have some very quick suggestions, I can keep it brief.
Okay. Yeah, it's really up to you. If you're okay with going a few minutes over, I think that's perfectly fine.
Yeah, I'm okay with it. Yeah, that's not a problem. I think for students, for international students who are in their process or their journey of navigating multiple things, my main message for them is to trust themselves, to trust yourself, to know that if if you find yourself questioning yourself in terms of, do I fit in here, or do I know less than anybody else in this? I think I want to challenge that and say, actually, you probably know more. Because as an international student, somebody from an international background, you are in a sense bicultural, right? You have lived in at least 2 cultures, if not more, depending on where you're coming from and where you've stayed. or where the cultural experiences you're bringing, and that's an advantage. That's an advantage over somebody who has lived here all their lives, and the system that is pre-existing is all that they know. You know?
Right.
And so I would hope and encourage international students to know that and to own that. You know?
Yeah.
Because, and this comes from my own voice of having challenged my own anxiety, in that I always thought I was less than.
Yes.
I always thought this is a disadvantage, and that I would not match on internship. I had just a lot of visions of failure and catastrophic thoughts of not succeeding, or my dissertation taking too long, and I'm not graduating on time. None of that happened. You know, none of that happened. And you know, I matched. I got my first choice. You know, and so yeah, so so all these are things that I can reflect on and say, well, yeah, I was, you know, 2020. Like, yes, I could have been less anxious. I shouldn't have taken this so much. Like, I felt like my identity was being questioned. And yes, that may happen. That's very normal. I think it's natural. But I think these are reminders you can give yourself that, you know, there's a reason you've come this far, even for you to have left your country, come here and navigate a different culture, is that takes a lot of courage and a lot of strength. So I think I would keep that handy as reminders every time you kind of feel or you wonder about yourself and question yourself or doubt yourself too much. For faculty and supervisors, I think going back to this idea of being curious and you know, and there's some assumptions are not, you know, we know this as psychologists and people who've been trained in this, is that a lot of it can be implicit, right? We're not intending to cause any harm. Yes, we know that. We know that that's not the intent, you know, but it takes somewhat of a deeper reflection to know that that may be happening. And for that, you have to be curious about yourself. You have to be curious about the person who is you're supervising or training, and really to be thinking outside the box, or not expecting that the person who is different from you is always going to have to educate you, because that's where the anxiety comes in for the student. That's where the it's burdening and it's exhausting.
Right.
And I say this from my own experience, and it's in fact detrimental to the person who's being trained, because you know, it takes a lot of faculty and a lot of energy to constantly explain or to prove that I am good enough and I'm good enough for the system and I have a lot to offer. So if the supervisor or the person in training is already aware of this going in, I think would probably be helpful for those being trained and for the system as a whole of psychologists. So we can all do better.
Right. Yeah, thank you for sharing. And I think that really resonates with my own experience as well as an international student. And I think the suggestions would be very helpful for faculty and supervisors, that they need to be open and curious about their trainees' experiences, but also take responsibility for educating themselves on the issues that they don't know about. Yeah. So I think that's all of the questions that I have for today. And I just wanted to thank you so much for sharing with us your journey and your experiences. And I appreciate how open and honest you are in sharing some of your anxieties and imposter syndrome. And I think we all have them to different degrees. For international students, it's probably even more common when we have an accent, or for some students, English is not their first language, and we're people of color, and all of those different factors. Thank you so much for providing a very supportive and positive message for international students.
Yeah, of course. I'm happy that I could be of help, and I hope that I hope Thank you so much for having me and doing this. Even just while talking to you, I was able to reflect on a lot of things from the past. So
yeah, same here. I think reflection is always really refreshing, right?
Yep.
Yeah. Yeah, thank you very much for being here again.
Thank you. Thanks for having me.
Yeah.